Next, we have Dr. Stanley Maposa. He's the Chief Program Officer of the Nelson Mandela Children's Fund, where he oversees 5 programs that also cover monitoring, evaluation, and special projects. As an executive committee member, he plays an integral part in the strategic development, implementation, and evaluation. Dr. Maposa holds a PhD in social sciences degree from the University of Fort Hare, where he majored on youth sociology and youth agency and participation in decision-making processes. He also holds a master's degree in developmental studies and other qualifications in disaster risk management and in policy formulation, implementation, and evaluation. Prior to joining the fund, Dr. Maposa worked for the Academy of Sciences of South Africa as a science diplomat for 7 years, and World Vision International as a development, disaster risk management, and advocacy executive at various levels. Presently, and past 6 years, he's been busy with community-based education coordinator of UCT in the Garden Route and training medical students on the rural platform. We really look forward to your talk.
Thank you so much for the generous introduction. I find myself at the center of practitioners in the health space and ourselves that come from the civil society. And I think that's transdisciplinary and interdisciplinary. And this presentation I'm making today talks to the work that we have been doing for the past 5 years at the Nelson Mandela Children's Fund. And we are rolling over a new strategy that will start from 2022 to 2027. And therefore, we are at a space of looking for partners that will work with us in ensuring that the health of children is attended as a priority in our country. That presentation just outlines briefly what the Nelson Mandela Children's Fund is all about. A lot of people know the Nelson Mandela Foundation and also the Mandela Rose Foundation. But the oldest of the legacy foundation is the Nelson Mandela Children's Fund, which was built in 1995 by the global statesman and icon, President Nelson Mandela. For his love for children, he started this organization whose vision is to change the way in which society treats children and youth. I think society has to do more around the issues of children as well as youth in this country, and you would agree with me on that. So the mission is about really building a movement that is child rights based, but also giving 2 things to children: a voice and dignity. And the things that we're talking about here, and Smai has been talking, and other 2 speakers, are around the dignity of children and whosoever they are and wherever they are found. So for our focus area that we deal with are the safety of children, which talks about addressing the vulnerability of children against the abuse of all sorts. And the second one on top is the health of children, which I'm going to talk about more. And far left is the empowerment and the leadership of children and youth in particular, so that they have a voice to speak to policy. We have been doing quite a lot of things with children as society, but not without children. So the Nelson Mandela Children's Fund creates platforms in Parliament for children to talk and speak to policymakers through what we call the Nelson Mandela Children's Parliament. And they have a manifesto that they've developed, which speaks to the issues that children would like to see in the policy spaces. And on the far right is what we call economic resilience, where we're building a capacity for the family to take care of the children. Our motivation and our hypothesis is that when children come from families where basic needs are met, mortality, as well as the protection of children against abuse will be addressed. So in terms of health, we are addressing the sustainable development goals to ensure that healthy lives and promotion of well-being of children in all ages, together with the target that is associated with that, which is ending preventable diseases, death for newborn children under the age of 5. The key message that we are bringing and that we have been bringing all along is that we find that society is not taking child death and child health seriously. When an adult dies, everybody gets worried that an adult has died. Maybe that person was a breadwinner, maybe that person was this and that. But when a child dies in some societies, it's as if nothing has happened. In some cases, even the burial is not announced because something insignificant has died, and that must change. It must change immediately. 2 interventions I'm going to discuss, and I'll sit down. The first one is that at the Nelson Mandela Children's Fund, we built a hospital. We built a hospital, and I think many of you that are here that are health practitioners are aware of the hospital, and I want to say it's one of the biggest hospitals in South Africa, the 2nd largest after the Red Cross, concentrating on treating ailments and diseases that affect children. It's a referral, private as well as public center, where we have got both the private patients as well as the public patients. The private patients pay through medical aid, but the public patients, we find ways to pay for them as they are referred to the hospital, so that no child dies with complications that can be treated. The hospital is pediatric and critical care complex and is one of the largest in the SADC region, offering a total of 48 neonatal and pediatric ICU beds. The hospital offers world-class care for vulnerable and critically ill children. I would invite you to take a journey to Gauteng and be able to visit this particular facility. And if you are working with children and you need to refer, this is the place for you to do so. Now, coming to the second program that we do is what we call the Child Survival, Development and Thriving Program. It is a program that is looking at the preventive side of child mortality and the death of children in our country, which is still growing despite all the good initiatives that are happening, despite the policy intents that are in place. The surprising thing is that children are still dying in large numbers in South Africa before they reach the age of 5. In the previous strategy from 2016 to 2021, our research found out that there were 20 districts that had high numbers of child mortality. Our current research right now shows that the number of districts have gone higher. Instead of being 15 or 10, there are now 30 districts where children are dying in large numbers before they reach the age of 5. And our question is, why is this happening? What is the problem? Maybe you as practitioners, some of you as researchers will help us to be able to dig deeper and find the root causes of child mortality in this country. So our program, therefore, then has 3 legs. The first one is what we call family outreach, where we get into homes, individual homes, through what we call community health workers, and they do door-to-door visitation of families, encouraging, nutrition, starting of nutrition gardens, psychosocial support, economic empowerment, building knowledge of child health, immunization, checking immunization, whether it's happening. In some cases, it is not happening, despite the knowledge of the expanded public health, immunization, and all those things. Immunization is still not happening in some of the communities in this country in the way it is supposed to be happening. There's still not compliance for immunization. And this has become worse with the COVID-19 argument around vaccination, and that families are no longer, taking their children to immunizations as they are supposed to be, and that's a serious risk in terms of the health of children. And the second part is what we call strengthening of health systems, community health systems, working with the clinics as the locus area of our work, training of these community health workers and clinic committees, which are bodies that our government has set to be able to provide some form of fiduciary and governance within the health systems in the rural areas and in the clinic committees, the clinic communities across the country, but also setting up data capturing systems and data management systems to be able to use innovation and IT. And the last leg is what we call community outreach activities, which includes awareness activities, roadshows, and dialogues, especially bringing in men to be part and parcel of the growth of their children. Our successes so far, we have, I can't go through the whole slide, but we have been seeing successes for the past 5 years of our implementation of the programs, capacity building that has happened in communities, advocacy work and messaging, documentation that we have started to do. We are looking for more partners. Currently, we're working with UniZulu, because most of the largest number of our programs are in KZN. So we're working with the university there to document some of the work that we do, but we're looking for other partner universities across the country in the spaces where we work to document some of these practices. Access to health care services has increased in the communities where we work, as well as the appreciation for technology. The issue is when home visitors or community health workers visit and they use technology. You talked about coffee phone, you talked about that a lot. How do you balance looking for information and engaging through your life with the communities versus capturing the information on the phone? Do you miss some information as a result of trying to capture on the phone versus talking and engaging? Those are some of the challenges that we've seen. But also the impact of COVID-19. I think this conference talks a lot about the impact of COVID-19 and how we have been navigating across that space, and ensuring that while COVID-19 is happening and the challenges around it, child mortality issues are addressed, and visitation of communities, as well as educating, communities around the importance of taking care of themselves within this particular period. 2 slides, and I'm going to sit down, which are our call for action, and also the issues that we are bringing into this conference. The first one is partnership. I've already indicated that we need to work together, whether you are in the academic space or in the practitioner space, in rural hospitals, wherever you are. I think if we partner together, but also with government at all levels, national, provincial, and provincial, all the spaces would be quite interesting for us to do. We have seen that at local level, local municipality and district level, there's so much willingness to partner. But as you move up to the national, I don't know what the problem is. You find some bit of resistance, and we need to be able to address that so much. Government and NGO relationship should improve in the country for the benefit of children. The fund believes that community health workers and community and clinic committees are very key to the strengthening of community health delivery system, but the capacities are low. And in the case of community health workers, remuneration as well as integration are issues that need to be addressed. I don't know why people that do so much work as community health workers are still ignored. in our country. There is a need for career development for them. Engagement for men and boys is quite critical. I see also in this room that men are not in large numbers. I'm challenging men wherever they are listening to me. Please come to the party. Funding is also limited, but the needs are high. And for example, in our last strategy, as I indicated earlier, there were 20 districts. Now the 20 districts have gone to 30. And some of the districts that we're working with continue to be there, but new districts are being added to districts that have high numbers of child mortality. There is also a need to research and understand why is child mortality still going on in our country in 2022, when there is so much that is already happening. Reduce mortality rate statistics at national level do not tally with what is happening on the ground at district and local level. And there need to be integration of a number of activities around the issue of child health. Child health is also associated with child safety and protection. We know the numbers of teenage pregnancies in this country. And the question is, who's making these children pregnant? Are children making themselves pregnant, or are adults involved? And why are they not arrested if they do that? Economic resilience as well as youth development. Finally, our call is better collaboration, joint fundraising, research and documentation. And we would like to be part and parcel of this annual conference as the fund. And we would like to bring in, as I've seen an example, communities that we work with across the country to speak for themselves in conferences like this ones for the work that we do. And yeah, we will be putting out a call in November looking for NGOs and NPOs that we want to work with. And I think this is an opportunity to advertise that, when you know some that are doing great work and they are qualifying in the criteria of our call for proposal that we're going to be launching in November, exactly on the 20th, please encourage them to apply and be part and parcel of this work that we do. This is the last slide that shows who we are and our strategic objectives, our core values and all that we do. And let's serve like Madiba. No child should die in this country when we are there, when good men and good women are there to save the lives of children. Thank you.
Thank you very much for that presentation. As an auntie of 8 children, I have really realized the value of treating children differently in society, and having a child parliament. I think that's something that I would love to see and look forward to. And yeah, I think the impact, what you've been doing, the impact of children on COVID-19 is very underestimated. And so yeah, we look forward to working together with you. I know Jackie here, we were talking about getting men involved in child and women mortality. So that's a big win, and we're very happy for that. Okay, we are going to go into lunch. So yeah, I think questions will have to be asked, find people and ask them your questions.